Start. Good morning, everyone. Today I'm going to present a case presentation on cerebral palsy. As I have previously explained that the cerebral palsy, it is a non-progressive disorder and associated with so many various disorder like hearing impaired, speech impairment, motor function, child with the cerebral palsy having the problem with the communication, eating problem, swallowing problem. So here one case presentation. Vansh Patel, a 13-year male old patient residing at the Gandhinagar from the socio-economical status, come with the chief complaint of the pain in upper and lower right and left back teeth regions since 6 months. On elaborating history of the present illness, patient was asymptomatic before 6 months, and then he felt pain in upper and lower right and left back teeth region since 6 months, and then the pain was continuous and aggravated at the night and relieving by taking the medication. So he has reported to the Department of the Pediatric and Preventive Dentistry, NPDCH, Visnagar. Now elaborating the dental history, the patient had undergone extraction of deciduous teeth before 4 years. Now elaborating the past medical history, his parents is giving the history of hypoxia at the birth time, which is the main cause of the cerebral palsy. Now, he has come, radiographical evaluation has been carried out, and according to the signs and symptoms, we have decided the treatment plan that 16263646 should be undertaken for the RCT, followed by the SS crown. Now, this child was anxious, and also he has a spastic cerebral palsy. So there will so writhing movement. So we are unable to do in the normal operatory field. So we have decided to do this patient in the general anesthesia. So for that, before we have done all the MRI, CT scan, and radiographical and blood examination. In MRI and CT scan, it is revealed that there is no epidural or intracranial hemorrhage were there. But due to the hypoxic condition, the cerebral palsy were there, and the blood examinations were the normal. So these are the pictures which are showing the patient's normal vital and signs. They are under monitoring with this condition. And we have done the RCT of 16263646, and this is the post-operative photographs which are showing that done RCT and followed by the SS crown. And post-operative instructions also be given, and patients were kneel by mouth since 6 to 8 hours. Then after gradually we have introduced the liquid, semi-solid and the solid food, and oral hygiene instructions also given to his parents. Now, as we know that the dental manifestations of the cerebral palsy, what I have explained before, the malocclusion is the main common. The intraoral picture, this is photograph which is showing the intraoral pictures of the typical patients with the good posterior class 1 and class 2 malocclusion with the anterior open bite, and the prevalence reported of the malocclusion is 59 to 92%, and angles class 2 with increase the overjet and overbite. And also there are chances that in such kind of a patient there is a habit of a mouth breathing. Mainly in the spastic patient, they have a habit of a tongue thrusting. They are tend to protrude the tongue. Also, there is a swallowing reflex, and frequently mouth breathing is seen. Now, the another photograph which is showing that this kind of a patient are showing the traumatic dental injuries like fractures of enamel and dentin. Then bruxism is very common. It is a habitual grinding of the teeth in a common occurrence in a people with the CP. In extreme cases, the bruxism leads to the tooth abrasions and the fat biting surfaces. Now, according to the Ortega et al. In 2007, he has found that along with the bruxism, there were habits of the pacifier sucking, finger sucking habits, and biting objects, and the tongue interposition. Now, according to the Minier WL, in 1956, they have hypothesized that the bruxism habit in these populations are related to the problems with the dopamine function and not regulatory by the local factors. It was shown that the abnormal dental wear is most closely related to the low level of the mental development, that to the degree of the severity of the CP. Now, dental caries are also frequently seen in such kind of a patient that the dietary consistency and the oromotor function were statistically significant influence on the DMF index, and also they are tend to excessive tooth decay and drooling of the saliva. Now, this kind of a patient sometimes associated with the epileptic with the cerebral palsy. So they are taking some anti-epileptic drug like a carbamazepine, phenytoin, sodium valproate. So it will lead to the gingival hyperplasia, also jaw dislocations due to the abrupt opening of the mouth, and also the excessive saliva in the calculus, which is deposition and leading to the gingival recession. Now the dental erosion mainly mostly affected teeth observed in the in the cerebral palsy patient, like upper molar 54%, lower molar 58%, and the upper incisor is 54%. And the dental erosion is a common in the cerebral palsy patients, and the dentist should be alert to early sign of this erosion in the cerebral palsy patients. And the treatment of the gastroesophageal refluxes should be done, because it will create the acidic pH, will lead to the abrade of the tooth, or it will cause the loss of tooth structure. Now, TMJ disorder, the presence of the CP, the male gender, and the severity of the malocclusion. There is a mouth opening and mixed dentitions were identified as a risk indicator for the signs and symptoms of the temporomandibular disorder. Now, enamel defect. Around 42.4% of the children with the enamel defects were born to prematurely, which is less than 37 weeks, whereas only 23.2% of them were born at the normal gestational age. Now, mainly as a pediatric dentist, we have already know that what are the manifestations of the cerebral palsy patient, but the dental management is very important. For that, there should be a dental access like a passenger loading zone, then parking space, then interior ramp, then wheelchair, then corridor, then science waiting rooms, then rest room, then public telephone, elevator, and the operatory area. So these were the considerations which is given in the McDonald. We should to follow and take care. Then this is the schematic diagram which is showing the accessibility of the dental operatory floor plan design for the either a straight or a side access doorway. Now, there, as I explained, that the operatory area should be a barrier free to facilitate the accommodate people with all kind of disability. This is the figure which is showing the the cylinder, and also that for the cerebral palsy there is a also there, and also the with the doorway there should be 32 inches wider than the normal. And the provisions of the wheelchair turning operatory movable dental chair and instrument control unit and the suction system. And the dental chair should be adjustable to the match different wheelchair design, etc. Such kind of come after the accessibility, as a pediatric dentistry, we need to because they are, some people are understand, but some people with the mental retardation they won't be attended because they are with some auditory and visual and the speech defect. So we as a dentist we have to modify the communication according to that. Then the posture, like a ataxic patient need to have a dental chair taped well back and give stability and the support. This spastic and atheroid may be a normal or manual support will be there. For that we need to take care that such kind of a patient we have to keep them midline in the dental chair, not right and left. Then also if a supportive adjective, if they want to feel relaxed and comfortable, then we should give some pillow and the cushions behind that. And also we can prevent some unwanted movement by the immobilization device. Then for that doing the process, there is a protective stabilizations for control the body and extremity, which is the triangle and leg strap. Paddy patient is in the paddy wrap, and the patients lying in the bean bag dental chair, which is mainly used into the hypotonic and severely spastic patient. And there is a further dental operatory area, like there is a protective stabilization. What I have the patient for jerky movement, so that for that mouth probe and bite blocks are also used. Now also we need some assistant to stabilize the movement, and board also we can use. Then protective stabilizations for the extremity, that Bose strap on the wrist and the towel and the tape for the forearm. It is a helpful for atheroid and spastic cerebral palsy patient who tries to desperately but without success to control the body movement. The protective stabilizations actually encourage the relaxations and prevent the undesirable reflexes by keeping the patient arm in the middle of the body. The radiographic examinations of such kind of patients also a task. So for that, the occasionally assistance from the parents and dentist auxiliary and the use of immobilization device may be necessary to obtain the film. And the film length should be 46 centimeter length of the floss, which is attached through a hole made in the tab to facilitate the retrieval of the film if it is falls towards the pharynx. And two type of the radiographic technique. One is the oblique head plate and reverse biting technique. The extraoral technique placement of the reverse biting and 45-degree of the head plate of the patients having the severe gag reflex. Now a finger guard may be used to simple one is the steel thimble with the cord or a chain attached through a hole and drilled near to edge to prevent the loss into the mouth. And it is advisable to use a steel mirror which is not shattered. And also great care must be taken care where there is a sharp instrument to avoid the damage into the soft tissue. Also in such kind of a patient that we can for the treatment like primary treatment we can use some oral screen to improve the lip incompetency, because such kind of a patients have more time to the lip incompetence. Then super brush, which is mainly help in aids to the clean the oral hygiene, and custom made exercise appliance to encourage the mouth opening. Now these are some techniques which are showing that how to hygiene, like standing or a supine position, semi-supine positions, and also with the help of the assistant or standing behind the parents in one arm, which is stabilize the heads of the children, and other freely hand will be which will be perform the oral hygiene instruction. And then we should proper oral hygiene instruction also given to the parents, and mainly the methods are horizontal and scrub method. And we should also advise that after the means after the feeding, the we should gently clean the infant mouth by the cloth, cotton cloth, and also try to make understand the parents as well also that how we should clean their oral cavity. And these are the some brushes which are with the modification. So such cerebral palsy kind of a patients, they are hold it properly and do the and perform their brushing techniques. And if sometimes in some case if they are not able to perform, then electronic brushes are also there. There one review article which is showing the general instructions for the cerebral palsy treatment management, that a short and the clear instruction should be a one time, active in a listening, develop trust and reliability, tell pseudo technique, apply a gentle pressure, we should not apply more than that pressure, then prior information regarding any stimulus, then dental instrument to be removed from the oral cavity, space creations in the working atmosphere, airway to be monitored to avoid the aspirations, and if something has happened, then call the emergency team. Now the one article, risk of the hospital treated injury in the children with the cerebral palsy, a population based study, in which there is a aim was to study to whether the cerebral palsy increase the risk of the hospital treated injury in the children up to the 13 year of the age. And they have concluded that the girls with the CP had a highest risk of the hospital treated injury, and children with the CP are partly prone to the traumatic brain injury. Now, evaluations of the effectiveness of the custom-made toothbrush in the monitoring of the oral hygiene and gingival health in the cerebral palsy patient. To evaluate and compare the efficacy of the custom-made toothbrush in maintenance of the oral hygiene and gingival health with that of the conventional toothbrush in the children with the cerebral palsy. And they have concluded that the custom-made toothbrush increased the efficacy in maintaining the oral hygiene and gingival health of the individuals with the cerebral palsy. Now, one case report that Bruxism control in the child with the cerebral palsy, in which there is a 7-year-old boy with a spastic cerebral palsy, chondroplegia. The parents reported during the pregnancy and the partition were the normal, and it was born in 14th week of the gestation. So when he was a 5-year-old, he spent 11 days into the neonatal intensive care unit because icterus with the moderate bilirubin level was there. So neonatal jaundice were there, which is the main cause of the cerebral palsy. And the child has been followed by the multidisciplinary approach, that is pediatrician, physiotherapist, psychotherapist, neurologist, and medicine taken by the patients daily included the Gardner, Loneral, Motley, and the retrieval. And there is a no extraoral finding were noted, but the intraoral examinations revealed a mixed dentitions and a good oral hygiene. All the residues teeth present the severe dental wear, which is indicated the pronounced bruxism. The enamel had been worn away and the large area of the anterior cusp and masticatory primary molar surfaces, and he had no salivary drooling and had adequate swallowing in spite of the evidence of the facials and hypoglossal nerve dysfunction. His parents reported to his that he used to eat ordinary food, but in the last 6 months, they had noticed that they appear pain while eating, and so he is not able to eat the proper food. So as the molar had extensive tooth surface losses, the stainless steel crown were proposed treatment for the primary molar under the nitrous oxide. Now, at the first appointment, the treatment for the right molar was carried out, and then the 7 days after the left primary molar is carried out, and a week later, they have given the protective oral appliances was designed to cover the maxillary molar in order to reduce the bruxism. And then for that, they have prepared a model and with the putty impressions and then model and the incisal model lateral and the frontal regions and the high abrasive ear of the primary teeth and the delayed eruptions of the permanent incisor can be seen. Then in figure 2, we can see there is a frontal weakness of the adaptations of the stainless steel crown, which is showing the eruptions of the permanent incisor. And in figure 3, we can see there is the model used to make the oral appliance before being the cemented on the patient's primary molar. And in figure 4, we can see there is a 1-year review of the crown that permanent central incisor can be seen. Now one another case report from that showing the amelogenesis imperfecta, a management for a cerebral palsy patient. A 10-year-old girl reported that the child with a cerebral palsy and aesthetically impaired as a result that of the abuse inflicted by her biological parents, and she is suffering from the pulmonary bleeding in the respiratory areas, which is main cause for the cerebral palsy. And then when she was a 16-month-old, and then the episode may be related to the developmental of the cerebral palsy. The patients were adopted when she was a 3-year-old, and then according to her adoptive parents, until the age of two, the child was only giving the liquid food through the syringe and pressure syringe and malnutritive. So there is in this photograph we can see there is a alternative finger sucking habit of the left thumb in anterior open bite. Now this is the photograph which is showing that the response of patients by the dental team and family member, clinical aspect of the dentition, panoramic radiograph. They have given the oral hygiene instructions, then important of using the fluoride toothpaste, then use of the mouth opener like PVC pipes, and they have done the extractions of 536374. Then also next sessions of the supragingival scaling. So this is the photograph which is showing the step-by-step restorations with the GIC in 1626364614. 152425, and this is the picture which is showing the PVC pipe which is a mouth opener with the wooden tongue depressor and use of the aspirate tube. Now this is the photograph which is showing the initial clinical aspect adopting the acetate crown. There is a prefabricated acetate crown were selected, and the crown had to adapt it by cutting the cervical border with the aids to curve the scissors and scalpel. After the undergoing rehabilitations, the treatment she was directed to prevent and periodic maintenance appointment. And this is the photograph which is showing that restorations in relation to 1 2 2 2 3 1 3 2 4 1 4 2 we can see. Now one another case reporting with there is a orthodontic treatment in the children with a cerebral palsy. They have shown that what I have already explained, that such kind of a patients are severely malocclusion and open bite and oral functional impairment in spastic cerebral palsy patients. So there is chances that higher frequency of the angle class 2 division 1 and increase overbite. Though such kind of a patients means with the normal intelligence, but they have some physical disability. There is criteria of such kind of patient as severe disability who are candidate for the orthodontic treatment. So we have to impression using a quick material, means it will set quickly. Then easy bending bracket, then self-itching primer, then advanced memory wire, then self-ligating brackets, then advanced in orthopedic surgery and reversible mini implants anchorage. Now this is a photograph which is showing that cerebral palsy patients with the severe class 2-1 malocclusions, initial phase, they are giving the face mask. Then in this second photograph showing that cerebral palsy patients with the class 2 in brackets sciences. And this third photograph which is showing that cerebral palsy patients with the open bite treated the using the fixed multi bracket appliance before undergoing the orthodontic surgery. Thus I would like to conclude that as the cerebral palsy is a non-progressive disorder, but it's associated with the so many disorder like problem with the communications, hearing impairment, visual impairment, then mental retardations, low intelligence. There is a quickly jerky and breathing movement, so patient is not able to clean his mouth. And what I have explained, that oral manifestation we also take in consideration, and also the etiological factor also we should considerations. And the one by one what I have explained, the management as a pediatric dentist we should take in care of it. So such kind of a patient if he enters our clinic, then we can handle it properly. Thank you so much.